Hello, this is Mike with SIMA, the Senior Insurance Marketing Association. Today we're talking about cross-selling hospital indemnity plans. Now you may have heard that there are no AEP commission payments until after January 1st per CMS, or Centers for Medicare and Medicaid Services. That is starting this enrollment period starting October 15th. So for any insurance policy you sell October 15th, you have a minimal 2.5 month wait to see a commission from that, either a Medicare Advantage plan or a Part D plan. Now, one way to help offset this delay in commission is cross-selling. Now, the key to cross-selling is taking two or more services and providing one overall solution. To give you an example, let's say you're out buying a new pair of pants and you go to the store, you find a pair of pants you like, you try them on, you go pay for them, and you're just about to leave the store, receipts in the bag, hands on the door handle, and the sales clerk comes up to you and says, "Hey, you know what would look good with those pants? This shirt." Well, the buying process is already over. You've already made your purchase, made your decision. You're ready to go about your day. You probably look at that sales clerk and say, "You know what, next time." Well, your insurance prospects are doing the exact same thing. If you go through one entire presentation, do the application, and at the end say, "Oh, by the way, I have this other product you might be interested in," they're probably going to look at you and say, "You know what, maybe next time." However, going back to the store situation, if you're looking at that pair of pants on the rack, and the sales clerk comes up to you and says, "No, it looks good with those pants, this shirt," you're still in the buying process. You have a much higher chance of buying that shirt before you've paid for those pants. Same thing with the insurance policy. If you bundle it together and you create a solution that covers all their concerns and easy to implement, they're more likely to make a purchase. So one way to offset commission delays obviously is cross-selling, and we're going to talk about hospital indemnity plans. So why hospital indemnity? Well, they can be sold at Medicare Advantage appointments. As you know, we're very limited on what we could sell and offer at Medicare Advantage appointments. But you can sell hospital indemnity. It's a natural policy to be sold at Medicare Advantage plans too, because it can help offset those copays they have throughout the policy. As you can see, it's on the scope of appointment form. Now, I do get asked a lot, my carrier has a specific scope of appointment for their product. Use two scopes then. Use one for the primary product and one for the hospital indemnity, as you can see here. Now, what are hospital indemnity plans? Well, they pay the client direct when they're admitted to the hospital. So many plans have pay observation as well. Observation is when someone's in the hospital but not considered an inpatient. They're just under observation. And this has been a big concern for Medicare patients because they need a 3-day hospital stay to pay for skilled care. So they may not be an inpatient, but if they're in the hospital, most hospital indemnity plans will pay, and they pay the client direct. Now, the nice thing about hospital indemnity plans is they have simplified underwriting. Typically, it's a 12-month look back. They have easy applications to fill out and easy rate calculation, which we'll go over here shortly. Now, most of these plans you can build to match your inpatient hospital copayments. So if they have a $300 per day copayment, a lot of times you can match that with the policy. You can add additional benefits such as ambulance, skilled rehab, emergency room, medical equipment. Some plans are more a la carte, where you kind of build your own policy, and some come prepackaged or ready to go. You just pick a certain plan level. Also, many have cancer riders that can be added to give a lump sum benefit on a cancer diagnosis. So you can kind of take their cancer concerns and their copayment concerns and bundle it together into one hospital indemnity program. Now, how do you offer this program efficiently in an appointment and make it easy to implement? Well, that's simple. You do it while you're going through the summary of benefits. As you can see here, I have a generic summary of benefits. The nice thing about the summary of benefits is that they're all the same. Benefit number 3, inpatient hospital care, is the same benefit number 3 in all of them. So they're all laid out the same. Of course, co-payments may change and probably will change from plan to plan, but benefit number 3 is always inpatient hospital care. Benefit number 8 is always doctor office visits, etc. So in this example, in network, we're looking at days 1 through 6, 265, and days 7 to eternity, 0. So when you're talking to your client, you can just say your hospital copay is $265 a day, days 1 through 6. After day 6, you're covered 100%. Now, we do have the option of adding a hospital benefit to this plan, so your out-of-pocket is zero, could be zero, should you be hospitalized. We can review that later if you'd like, okay? This is a great way to plant the seeds for a hospital indemnity program. Now notice I call it a hospital benefit and not a hospital plan or a hospital policy. People aren't keen on buying insurance, but they want the benefits that insurance offers. So call it a hospital benefit. Also, one thing I didn't put in here, but you might want to say is it could cover most or all of would be great. You don't want to give absolute statements when you're talking about benefits because they may still have some out-of-pocket costs. Now, we can review that later if you'd like. Okay, so the client knows, okay, we're going to talk about something a little later. You're getting permission and telling them, hey, we're going to mention this hospital benefit at the end. Now, as you go through the summary of benefits, you touch on other co-payments that could be reimbursed. I structured mine with an inpatient and ambulance benefit with the option of cancer. So you could pre-bundle your packages, kind of make your own package that are really popular, or you can kind of do it on the fly. It's up to you. I like doing it pre-packaged, and I'll show you why here shortly. Now with the cancer rider, in the fact-finding section of your appointment, you're going to need to see if cancer is important. Besides your current Medicare Advantage plan, what other funds do you have in place to help offset any cancer treatment costs? You can say something along these lines. What that does is it makes them realize that they will have out-of-pocket costs should they be diagnosed with cancer. And if they're getting a lot of chemo, a lot of treatments, those payments will really add up over time. So you're not trying to put the fear of God into them. However, you're trying to make them aware that, there will be costs to treat that cancer. Now, when you get through the summary of benefits at the very end, so remember the hospital benefit I mentioned? Well, here's how it works. You have a couple different options when choosing a plan. You have option one, you have the plan with full co-payments for X $1 per month, whatever the plan premium is. Notice I said full co-payments. That means every co-payment I mentioned to them, they have to pay in full. Now, option two, you have a plan with reimbursement for hospitalization and ambulance services, and you can tell them what that benefit is. Try and pick a benefit that will cover most of the plans in your area. So if all your plans are on $260, $250, $240 a month, per day for hospitalization, try maybe go $300. That way, if there's any fluctuation over the years in the hospital copayment, that the plan still covers them. So this plan option 2 will give you $300 per day to be in the hospital, paid directly to you, so any overage you could use for any additional drugs, doctor office visits and such. It also pays for an ambulance ride. So if you have an ambulance service, they will reimburse you for that. And this plan is X $1 per month. Then with option 3, with everything option 2 has, plus a $5,000 cancer benefit. So if you're diagnosed with cancer, you'll get a check for $5,000, and you could use that for chemotherapy treatments. You could use it for additional drug costs. You could use it for doctor visits. You could use it to hire additional help in the home while you're recovering, so you could rest more efficiently and not worry about cleaning the house or laundry, meal preparation, running errands, etc. And this plan is X $1 per month. And of course, you may have questions, so answer the questions, but you want to offer 3 different solutions. Now, what I did, and one of the things I mentioned earlier was I did a cheat sheet for my hospital rates. So I took a simple spreadsheet. I took their age, hospital indemnity plan only, and hospital indemnity plus the cancer benefit. So if I was talking to a 66-year-old, I could open up my notebook and see, okay, $66, $31. I don't do any rate calculations. Now, of course, my hospital indemnity plan only, I also included the ambulance service. That, of course, is up to you, but this way I had a quick, easy way of referencing the rates. And then I could add really easily the $5,000 cancer benefit. So it's just a quick, easy cheat sheet for myself. You could do it with a simple spreadsheet. Just calculate your ages real quick and your premiums, and then print it out and throw it somewhere in your notebook, in your binder, whatever you're using to carry with you. Now, the other great thing about hospital indemnity plans, if there's no Medicare Advantage sale, like they're not going to switch plans, you could still offer the hospital indemnity plan to the current Medicare Advantage plan. This is why it's important to pick up a hospital benefit that will pretty much cover all the plans in your area. So you could say to your client, remember the hospital benefit I talked about? You could still add that to your policy. So you can have the benefits of, if you go to the hospital, that you're not going to have to pay that big copayment. You can get reimbursed for some or all of that, and you can just go into the explanation. So, of course, you can use a personalized care plan form. This is available to download off SIMA. You can talk about their health coverage, see the additional benefits. It comes in Word format, so you can delete any benefits you don't offer, then offer one solution. You can either use this piece of paper to show you 3 options, or you can use a simple legal pad. Of course, it's up to you. Now, this is the part where we opened up for questions on the live version. If you are looking for an FMO that has hospital indemnity options, both senior marketing specialists and Ritter Insurance Marketing both have hospital indemnity plans available. I suggest contacting either or both and talking to them and seeing which FMO you like better, and getting contracted and getting hospital indemnity plans under your wings for this AEP. So I want to thank you for watching this video. There are additional resources on SIMA Pro, so visit us at SIMA-net.com.